Good evening, I'm Olivia Quay with a special edition of The Big Story. News just in, the Health Ministry confirmed 2 more coronavirus cases, bringing the total to 110 in Singapore. One of the new cases, case 110, is linked to the cluster at Wizlearn Technologies. He's a 33-year-old male Singaporean who has no recent travel history to affected countries and regions. Meanwhile, contact tracing is underway for the other case, case 109. He's a 70-year-old male Singaporean who also has no recent travel history to affected countries and regions. Before he was admitted at Singapore General Hospital, he had gone to work at Fish Mart Sakuraya along West Coast Road, but he had not served customers or handled food. Case 109 stays at Everton Park. No patients were discharged today. 1 more person is in the ICU, which means now 7 patients are in critical condition. It was announced earlier today as well that from Wednesday, travellers who had been to South Korea, Northern Italy and Iran within the last 14 days will not be allowed to enter or transit through Singapore. Singaporeans, residents and long-term pass holders who had been to these places will be allowed in, but they'll be issued a stay-home notice. The Health Ministry also urged Singaporeans to defer non-essential travel to Iran, Northern Italy, South Korea and Japan. In addition to these measures, the Ministry is implementing precautionary testing for symptomatic travellers.
In addition, we are putting in place a new screening mechanism at our checkpoints, because we know that the temperature scanners alone are not sufficient. So we will now also look out for people with respiratory symptoms, identify them and request that they take a swab test in order to test whether they are positive for the virus.
This will be in effect from 11:59 p.m. on Wednesday. Short-term visitors who refuse to undergo the test will be denied entry. Singapore permanent residents and long-term pass holders who refuse the test could have their passes and privileges revoked or shortened. Mr. Wong also stressed the necessity of these border controls, given that the virus is spreading quickly around the world.
The border controls are still useful at this stage of the epidemic, because we can still identify where the sources of risk are, and then we can take appropriate measures to reduce the risk from these infected sources. And by doing so, we flatten the epidemic curve in Singapore, we buy ourselves time, and then we avoid a situation where our hospitals get overwhelmed by a sudden surge of cases. So this is useful, but we have to be prepared that at some stage, the border controls alone will not be sufficient, and we cannot stop the virus at our borders, because the virus will spread to countries everywhere around us. And even in countries where they do not report a lot of cases, there may well be undetected cases of virus infections going around. So we will be exposed at that stage to multiple waves of infection, and we have to be ready for that.
And that's the update on the situation in Singapore. Stay up to date with developments at straitstimes.com. I'm Olivia Quay. Good night.